In this video, let me introduce you to another important hospital metric, bed turnover rate, a simple number that tells you how efficiently your beds are actually being used. Let me ask you something. In your hospital, how many patients does one bed actually treat? Not at one time, but over a week or a month. That number is bed turnover rate. Bed turnover rate is simply number of discharges divided by number of beds over a period. In simple terms, how many times one bed gets used. Now imagine two hospitals. Both have 100 beds. In one hospital, each bed treats 2 patients in a week. In another, each bed treats 5 patients in the same time. Same infrastructure, same number of beds, but completely different impact. The second hospital is not just busier, it is more productive. Now, why should doctors care about this? Because bed turnover rate is not just an admin number. It directly reflects how efficiently patients are managed, how smoothly discharges happen, how well the system flows. When turnover is good, more patients get treated and the hospital runs efficiently. But like every metric in healthcare, there is a balance. When bed turnover rate is too low, patients stay longer than necessary. Discharges are delayed, beds get blocked. The hospital may look full, but actually underperforming. On the other hand, when bed turnover rate is too high, there may be pressure to discharge early. Patients may not be fully optimized. Readmissions can increase. So a high number is not always a good number. That's why bed turnover rate should never be seen in isolation. It is closely linked to length of stay. Shorter stay increases turnover. Longer stay reduces turnover. But the goal is not to make it short at any cost. The goal is to make it appropriate. Right patient, right duration, right discharge. A good practical range in most hospitals is around 4 to 6 patients per bed per month. But this varies with complexity. Tertiary care centers may have lower turnover, and that is perfectly acceptable. So the real question is not, how high is your turnover? The real question is, are you using each bed optimally? Not rushing patients out, not delaying care, but maintaining a smooth, safe flow. Because at the end of the day, a hospital is not defined by how many beds it has, but by how many patients each bed can safely serve. And that is the real meaning of bed turnover rate.